Welcome back to the Health Tech Edge. I'm Mike Moore. This season, we're focused on how AI agents are reshaping healthcare. Today, I'm joined by Jessica Richmond from Google Cloud. Jessica leads AI go-to-market strategy for healthcare and life sciences. She works closely with health systems and payers to turn AI plans into action. Jess, welcome to the show.
Thank you, Mike. It's great to be here.
Yeah, it's great to have you and interesting to get into some of the work that Google is doing in this space. I know that Google is active in healthcare and helping customers, and I think that's what will make this discussion interesting for folks because of the leadership position that Google has in the industry and how companies look to you for advice. Clearly building AI solutions for your own business, but then also helping customers enable theirs. So maybe that's where we'll start. Just kind of what you're seeing in the day-to-day work that you do with customers. What are some of the top problems that they come to Google with and say they'd like some help solving?
Sure. This is a really exciting place to be right now. And all of our healthcare providers, payers, life sciences customers are all thinking about and working actively in AI. I think some of the really interesting places that we're having conversations and driving strategy as well as agent development is around these theories of how are we going to increase the patient experience and how do we elevate providers to the peak of their license. That's something we talk a lot about here at Google and are working with our customers to do. So, a lot of our time is spent on the strategy of what are the areas that we can optimize the patient experience, taking a hard look also at revenue. So, it's important that we drive not just a better patient experience, but also that we're looking at real revenue generation or cost savings so that can be refunneled back into the business to support patient care. So that's where we're spending the majority of our time right now, and we're seeing the most interesting use cases.
Yeah, and I think that's a theme we've heard from some other guests on the show as well. Just there's such a tremendous opportunity, but a lot of the focus really is, the healthcare industry has many challenges, but among them, what many look after is that kind of the experience, not only for patients or health plan members, but of the staff that work in the business and the burnout. I think, COVID obviously was an incredibly difficult time for everyone globally, but especially those clinicians on the front line. But this focus on helping them work at the top of their license is really key, I think, and seeing what administrative matters we can take away or simplify from their experience so that they really spend the majority of their time focused on patients and members, which I know is so important. Um, so there's a lot of stuff out in the media right now, kind of the bright and shiny use cases that everybody gets excited about. How are some of the leading healthcare organizations that you work with thinking about platforms and also governance? Because we can't take AI lightly and just kind of let it go in healthcare, right? There literally are life and death implications to the work that it does. So how are some of your customers approaching this?
Absolutely. It's a great question. And last year, it was really the year of looking at use cases and use cases almost exclusively. And what we're finding this year, even in Q1 of this year, is some of our customers and the work that we're doing, there's not just a handful of use cases, there's sometimes 50, 60, 100, or hundreds of use cases for how they can improve their business, patient experience, and also manage the revenue lifecycle. So, what's really, really important now is time to market and looking at that platform and governance approach. So, how can we solve the challenges around enterprise efficiency? How do we solve the challenges around governance? And how do we make sure that there are secure platforms so that when there is an idea for an agent, it can be developed very quickly and it can be deployed to the right people at the right time with a high level of confidence for security? And that's where our Agentspace platform comes into play. It really isn't just about the one or two high priority use cases. Those are certainly very important. It's about setting ourselves up to be able to take advantage of a rapidly changing environment and deploy those future ideas either with low code or no code agents developed through our platform or first third party agents that come from other sources as well. And being able to do that again to the right employees, the right practitioners at the right time.
Yeah, and I think you're in a really unique position as Google because you are a platform company, right? You can certainly put all the foundation elements in place on which customers can build. You also have a tremendous partner ecosystem as well, both ISVs and system integrator development partners, right, that can create solutions on top of all of that. when you think about kind of the products that are available at Google and how you put these pieces together, how's Google thinking about what they build versus what they enable from a customer and partner point of view?
All right, great question. So, this is really important. We believe that having a platform that supports the models that we develop, the agents that we develop, the agents that our customers are going to develop, as well as third party agents that come from other areas of the market is incredibly important. So, our focus is on making sure that Agentspace as a platform is providing the governance and security and accessibility for those experiences, the ones that we know are coming in the next 6 months and the ones that we anticipate coming in the next 12 months, and the rapid growth that we expect to come from the agentic experiences that our providers will need to better support patients moving forward.
Yeah, I think that's one of the things that's really interesting to me about Agent Space and kind of what Google has delivered is that you've put a front end out there that can be used both for Google-based solutions as well as third-party, ISV solutions or things that have been created by the customers themselves, right? But from an end user experience standpoint, it gives you a framework to snap into and make those experiences have some place that they live, right? And the ability for those to interact, as you talked about, with the agent to agent standards that Google has helped develop and put into the industry. That's another, I think, from an industry leadership point of view, it's helpful when the bigger players like Google help establish those industry standards to let others then kind of plug in and map to it so we can have collaboration because it's very rare that we see customers with simply one technology stack, right? They're always trying to integrate multiple technologies.
That's absolutely correct. And we envision that complexity to increase, not decrease. And the challenge of managing point solutions is a real challenge, especially for large healthcare providers. And that's one that we're heavily focused on solving with Agent Space. And again, it's about the knowledge workers, the frontline workers, clinical, administrative workers. The more time they can spend serving patients, the better. The faster we can serve up information and provide these agents to them in a safe and secure way, the more they're focused on the heart of the business, serving patients and providing top quality healthcare in this country.
Yeah, and that's a great transition, I think, to the next question I was thinking, which is, what are some of those use cases, right? Like we talked about kind of the foundational pieces in the governance model and the agent space in terms of how to deliver, but in terms of where your customers are tending to focus right now, what are some of the things that they're finding of great value and that, are things they can prioritize and work on now?
Sure. Some of the areas that we're doing a ton of work on is how are things like claims managed? How are they processed? How are they prepared? How do we get more efficient at doing that? How do we leverage agents to streamline that process and decrease the churn that historically has occurred within the community? Another area is looking at how can we access data from a variety of sources and serve that up in an actionable way to help providers or administrators better serve customers and patients. And there's really interesting work that's happening. I think we're familiar with some of the work that's happening on the imaging side, but when we look at key indicators for things like sepsis identification, there's a lot of data that exists, and there's a lot of data that exists in the patient experience that can be really hard to pull together. And these are areas that we're working with customers on to identify and help predict and prevent issues when it comes to things like sepsis. So that's we see that being an important area of the agentic experience and impact that we can have for healthcare providers. And I think there's also areas around patient readiness and preparing for appointments that is an incredible opportunity, a major source of lost revenue and customer or patient dissatisfaction is when appointments aren't effectively prepared for. And that's something that we see AI playing a really pivotal role in. There doesn't always need to be a full human in the loop. There's a lot of check in, human check in that we can do to help prepare these patients, save money, reinvest for the hospital, optimize bed time, and ensure that the patient has a better experience, they're prepared, and they have the right follow up following an appointment or a procedure.
Yeah, just there's so many opportunities. I think, like you said earlier, that we've had so many cycles with customers just going through the use case development, right? And part of that is development around just kind of what are the possibilities, right? What are the things we could do that could go so much faster and kind of and then there's, the governance piece and the risk management part of that too, and kind of assessing from a risk point of view. And then like, how hard is this stuff to build? What's the value of it, and what's the return on investment? This could, many factors, I think, that challenge healthcare organizations with looking at this tremendous opportunity. So when you think about customers who are stuck, maybe they get stuck in that, right? Like, Jess, there's so much on the table here in front of us, we don't really know where to go first. What's the advice that you give them about how to get unstuck in those situations?
Yeah, so prepare for scale. Prepare for the reality of scale and the pace that you are going to need to keep up with. Whether we like it or not, all individuals are now using AI in their daily lives, and we can't prevent providers from also leveraging AI. What we can do is make sure that we are providing it in a way that is highly secure, that supports things like HIPAA compliance, that isn't passing information back to the public web. And we need to provide that pretty quickly because as we incorporate these actions to our daily lives, patients are expecting it and providers are expecting it as well. So I think keeping that in mind and also knowing we are seeing scenarios where low code or no code agents can be developed within hours or deployed within days. The ability to move fast once you have your platform in place and you've addressed governance and security, it's truly incredible. So the more we can empower the enterprise organizations that are supporting these hospital systems to identify and deploy agents very, very quickly, the better the ROI and the results are. So the first thing we recommend is jump into an early POC, look at things like what are my governance and security requirements? How do I think about this at scale, not just as one use case? Because you want to solve your scale for the entire organization and then pick your top maybe 2 to 3 high priority, high value use cases and get started. And use a sampling of things that may be, low code, higher code. This is going to help figure out how your organization is going to work in this new world. And it allows you to put the right guardrails in place so that you're ready to move quickly.
Yeah, and I know that there's a tremendous set of tools that Google makes available, whether it's Agentspace and kind of other tools on the Google Cloud platform. There's partners, Productive Edge. We get involved in a lot of this work with customers where we'll do kind of our AI action planning workshop and kind of get, everything out and put everything up on a Miro board and prioritize the sticky notes and all that. But then pull out of that, like, where can we go, right? Or like, let's rapidly, test some of these ideas and see. But I would love the advice about thinking about scale, because what if it takes off? Now all of a sudden trying to put the governance, the PHI data protection, the monitoring, the observability, all those kind of elements in place. As kind of we always talk in tech, especially, being in tech for a number of years, like you have, we talk about kind of building the race car as we're driving down the highway. Well, like, there's a
Yeah.
certain amount of that in healthcare that really doesn't work because it's kind of hard once data has been exposed, or, these kind of things, right? We worry a lot about, are people being treated fairly by AI, right? Based on gender or race or socioeconomic, social determinants of health elements, all these other kind of things, right? Like, having all the tracking elements in place so we can monitor those things as we're getting an application off the ground is so key. So there's definitely some experimentation phase work that can be done, but once we start doing real things and preparing for scale and doing that in a responsible AI mindset, are so important.
Yeah, that's absolutely correct. And doing both those work streams at the same time is my biggest recommendation. Pick those high value ones, look at your governance and security, look at your platform scale, because it's going to happen faster than you anticipate. And what we are seeing right now with our current customers is it's a viral effect. It's a viral effect within providers, within enterprises. And once I have a really great experience leveraging an agent, I'm going to immediately be sharing that with my colleagues. And we want to be in a position where we can take advantage of that to get the return on investments, not just for the softer costs in terms of efficiencies, but there's some very significant hard ROI that comes along with these agents that are deployed in healthcare.
Oh yeah, and yeah, we've seen a lot of success in the organizations when either we or they are using some of these low code or no code tools to go rapidly prototype something, so they have a visual concept to show, and then that virality, like you talked about, just kind of takes off because seeing is believing. It's kind of like if you've ever uh, built a house, right? And if you or your partner, like one of you has the vision of what things are going to look like when it's done and the other is struggling, that's the kind of thing we see happen over and over again in these scenarios. And so now all of a sudden, when we have something to show, a concept that shows what it's going to look like or what it could look like, all of a sudden the light bulb goes off for others. People get on board. We start to align. We start to focus, right? And then good things happen. So all kinds of exciting opportunities.
That's exactly right. It's a great analogy. Thank you.
Yeah. Excellent. Well, thanks, Jess, for joining us today. Great insights as always, and we're excited about the work that we do with Google and that you're doing with customers in healthcare. We'll include some resources in the show notes so people have some links to follow if they want to check out and learn more. And hope we can have you back again, go deeper on some of these topics in the future, maybe with one of your partners next time. So we'll think about doing that down the road.
Great. Thank you so much for having me.
Yeah, of course. Well, thanks for listening to the Health Tech Edge. If you enjoyed today's podcast, please share it with a colleague and don't forget to follow and receive future updates. Until next time, thanks for joining the Health Tech Edge.